Hello friends, this is Elle again. Welcome back to my channel. Today I'm going to be talking about GI and muscarinic antagonists and its relationship to GI ulcers and other drugs that's available for ulcers. So the way I'm going to approach these drugs or this group of drugs is through a point of view of ulcer. So these are not the only drugs which are available for ulcer. So I'm going to talk about ulcers, and then I'm going to talk about muscarinic antagonists which prevent ulcers. Now, so the first kind, let's just say, is our muscarinic antagonists. That's one type of drugs that we give patients for ulcers. There is also other kinds of drugs. For example, the first one I should be mentioning is H2 blockers. And those are the ones which prevents the H2 receptors, which is very often prescribed by physicians. There is also proton pump inhibitors, and there is also bismuth and sucralfate, which are also provided for ulcers. And last but not the least is misoprostol. Okay, so before I go into muscarinic antagonists, I quickly want to go over these 5 group of drugs. So muscarinic antagonists, they obviously block the muscarinic receptors. I'm going to talk about them at the very end. H2 blockers, they block H2 receptors, they prevent the release of histamine, they prevent the release of H plus protein secretion in the stomach by the parietal cells. The proton pump inhibitors, they block the hydrogen potassium ATPase in the stomach, and that's how they prevent the H plus release into the stomach and prevent acid secretion. Bismuth and sucralfate, those are nothing but physical protection onto the ulcer. So they don't really prevent anything, they just kind of physically go and sits on the ulcer, preventing any further damage. So coming back to, oh, and also misoprostol, sorry I didn't go into that earlier. Misoprostol is a PGE1 analog. What's a PGE1 analog? It's a prostaglandin 1 analog, and you would know that prostaglandin is responsible for increased production of gastric mucus barrier. So it gives a nice lining in our GI so that when acid is being released, it doesn't damage our GI lining and cause ulcers. So if we have that analog, then it's going to increase the production of our barrier. So that's misoprostol. But I'm going to talk about each one of them separately. I just wanted to give the 5 drugs responsible for preventing gastric ulcers or treating gastric ulcers. Anyways, so now let's talk about our muscarinic antagonists. The 2 muscarinic antagonists are pirenzepine and propantholin. Okay, so you know by now that sympathetic and parasympathetic. Sympathetic is when there is fight or flight, and parasympathetic is when there is rest and digest. So when we want to digest anything, our parasympathetic kicks in. Now these enzymes, these drugs, is actually going to block our parasympathetic. Okay, now what is the mechanism of action of this drug? Okay, yes, it's going to prevent our parasympathetic, but exactly what? This is very important to know. So this is where the detail comes in, and this is where we have to know our details, and that is it's going to block M1 receptors. Okay, it's going to block our M1 receptors, and it's also going to block our M3 receptors. Okay, what happens if it blocks our M1 receptors? They're both muscarinic receptors, but they kind of act a little differently. Our M1 receptors is responsible for releasing histamine, so it's going to decrease histamine secretion. Okay, where our M3, and you know that histamine also responsible for more proton secretion or more acid secretion in the stomach, where M3 receptors are responsible for directly decreasing proton secretion onto our stomach. So the detail is it blocks M1, and what does M1 do? M1 prevents histamine secretion. As a result, it decreases acid secretion, and it also blocks M3 receptors, which also decreases proton secretion. So together it has like a dual effect on our parasympathetic receptors, and as a result it decreases all the acid that is being released. Now, what is the clinical use? Clinical use is peptic ulcer. That is the only clinical use for this group of drug. Now, we want to talk about the toxicity of this drug. Whenever we prevent muscarinic, what happens is that our sympathetic gets stimulated, because they go hand in hand. If one is depressed, the other will kick in. So as a result, there is some side effects to this drug, and the side effects are sympathetic side effects. For example, tachycardia. For example, dry mouth. For example, no sweating, no sweat, or so anything that is sympathetic, but the most prevalent one is tachycardia. If I'm not wrong, I think M3 receptors are also found in the heart. So whenever we're blocking M3, our sympathetic kicks in, causing the tachycardia. So this one just works naturally. This drug is just logically, it will make sense what happens when we block the M1 and M3 receptors. Okay, so that's all about muscarinic receptors. I'm going to talk about the other ulcer drugs in my next video. Thank you.